What's up, y'all? You know who this is. This the real King, man. You're listening to King's Firmament. I'm your host. Did I say Terrell already? Okay, yeah, I said it already. Let's beat them tweets. Today is about the health care crisis that's going on today in America and more likely in the United States as well. But we are in a real bad situation that we need to get up out of. And you know, the pandemic has made the United States healthcare crisis far more dire, and you got to fix it, man. Because I'm gonna tell you about this article. Well, I'm just gonna start talking about it. Okay, when it comes to our current healthcare system, the waste, cruelty, and dysfunction was glaringly obvious even before the pandemic we are now experiencing. Today, as millions of Americans lose their jobs and their healthcare benefits come with them that come with the job. I mean, it is now virtually impossible for any rational person to defend a system unique among wealthy countries that ties healthcare to employment and is designed only to make huge profits for the insurance industry and drug companies while ignoring the needs of ordinary Americans. And that's every day. Every day right now, that's what they're doing. They don't care, man. It's all about a dollar. People are, man, listen, man. People are literally dying, man. Dying. Before the pandemic, 87 million people were uninsured or underinsured in the country, right? And more than 30,000 people died every year because they couldn't get to the doctor when they needed to see one. Joe, more than 500,000 families declare bankruptcy each year because of the medical related debt. Like, come on, bro. Like, y'all don't see this shit. Like, don't nobody talk about this shit. 1 out of 5 Americans cannot afford the outrageously priced prescription drugs their doctors prescribe to them, man. And our healthcare outcomes from maternal deaths to life, infant mortality lag behind most of their industries, nations, man. Think about that shit. Like that's come on, G. Y'all don't see these motherfuckers making that money. They making the bread, the moolah. Man, look, I know. Look, what I was just reading, they said the United States still spends nearly 11,000 on healthcare for every adult and child, more than twice the average of other major countries. And why is that? And I think that was before the pandemic. I think when I was reading that. Come on, bruh. For real? You gotta think about it. As I'm talking right now, people are losing their jobs, bro. More than 26 million Americans have lost their job, bro, and now face a crisis unique among advanced countries. You hear me? Look, for most of them, their health care was tied to their jobs, man. So when they leave their jobs or they get let go, they ain't got no health care. None. So because of that, I think it's up to 35 million Americans are estimated to see their health coverage disappear in the middle of their COVID-19 nightmare because that ain't over with, bro. They got a new strand of COVID that's out. They ain't talking about none of that shit. New strand of COVID that came out right. New strand of SARS that came out right. But they won't help nobody in healthcare, bro. They cutting everything, bro. Like, come on, bro. Man, look, premiums for who retain their health insurance in this crisis could increase up to about 40%. So you're already paying a high price for the insurance, right? It's gonna go up 40%. You get what I say when people work like nowadays work for a check to get things done. And people wonder why. I ain't gonna even lie. People wonder why people be hustling. And I ain't talking about, the bad way. Selling plates, you know what I mean? Cleaning out houses, starting their own cleaning services, PCA services. But the PCA services ain't doing nothing right now because of the healthcare crisis. You gotta think about it. Do y'all remember it was like what? 34,000 coronavirus medical bills? You know what I'm saying? That I think uninsured remains terrified of going bankruptcy, G, just to get tested and treated for COVID-19. Y'all remember that? In many cases, they couldn't afford to go to the doctor or the hospital, so they'll sit there with the shit, respiratory problems, people dying. Are you serious, bro? But it's not. But what the people fail to realize, right? It's steady growing, bro. It's growing and growing and growing, man. It's growing, man. Like it's shit crazy, man. Like, look, our public health system is incredibly weak, man. For real, in part because of consistent federal disinvestments, you know what I'm saying, that have decimated too many public, health agencies, fucking them up. You hear me? In most states, we lack the capability to significantly increase the level of coronavirus testing and contact trace, and contact tracing we need to begin the safety reopening. So reopen the economy. Um, I don't know, man. I don't know. You gotta think about it. In 3 years ago, the student debt crisis reached 1,696,047. What was that? 147,311 and $620. G. I don't even know if I said that shit right. For real. Price gouging and shit, man. It's crazy, bro. Don't nobody wanna say speak on that shit. I don't wanna speak on that shit. You know? And then I'll be like, shit, look, the healthcare crisis, man, is a progressive and massive rise in costs, coupled with a failure of systems to provide care to a large minority of population. Do I gotta say it again? A progressive and massive rise in cost, coupled with a failure of the system to provide care to a large minority of the population. Let that sit for a minute. Let that shit sit for a minute, foo. You know what I mean? You know that like hospitals they can't raise their rates to cover and increase costs. You know what I'm saying? Like it's crazy, man. And then they think that people don't be like paying attention to this shit, bro. They think people don't be paying attention to this shit. I pay attention to it because I'm in a situation where I need to depend on certain people to help me. You know, I'm disabled myself. I don't let that um, make me who I am, though. You know, I don't let that make me who I am. Not at all. Because, like I said, I'm the one who has to uh, be able to um, fight. Can nobody fight for me but me? Nobody but me. You know, like y'all, they think 2.3% ain't a lot. That's a lot, bro. That is a lot. You know, the industry faces difficult conditions in 2023, man, and it's probably because of like the continuing high inflation rates and labor shortages. They talking about they expect improvement in 2024 and beyond. Motherfucker, how? This shit ain't even fucking fixed. It's hey, America, America. This shit ain't even fixed for both of them because they tripping. Yeah, boo they ass. They tripping, man. They be tripping, man. Look, let me tell you something. This shit here, man. How they gonna fix it? We still in the crisis right now. Fuck 2024. So they said by 2025, an integrated digital first healthcare delivery model signposts patients to the most appropriate care settings. Uh, no, I don't believe it. None of that. I don't believe that shit. I don't believe that shit. They lying their ass off. I wonder. I ain't. I ain't with all the bullshit. But to be honest, motherfuckers should invest in healthcare for real. A motherfucker should invest in healthcare, man. And maybe some shit might turn around for real. Like I be thinking about, like, look, G, they already talking about this. Look, they talking about the digital doctor, cancer cures in a cancer cures in a dish, the mundane and the fantastic. What was the other one? The smart hospital room, genetic testing for all, and broader diagnoses, and a very patient device. So that's what they're expecting in the next 10 years, bro. The next America, America, 10 years. How the fuck, sir, sir, man, sir? I just want to say, how, man? Like how the fuck? How is that even possible? Y'all ain't even got shit fixed now. Dang it, what's the they ain't even got shit fixed now. Like, man, tell us how y'all gonna fix this shit for y'all talking about we think how it's gonna be in 2024 and 25. Motherfucker, we in 2023 right now. Tell me what the fuck gonna happen now. I need to know. Player. Echo. Mute TV.
Okay.
Yeah, man.
On average, men in the United States are 5 feet 9 inches tall.
I didn't tell that bitch to say nothing, y'all. I
Didn't
swear.
quite get that. Tell me again.
Stop listening, bitch. You know, this bitch just try to fuck up my shit. You saw that? Dirty bitch. But back to what the fuck I was saying. I ain't adding shit. I'm keeping it like that. I ain't adding shit. I wanna break it right now for trying to fuck up my shit. Bitch. But we still in the we had a crisis, man, for real, bro. Don't nobody want to talk about this shit. I'm scared though. I'm scared that there's gonna be a lot of more deaths. I'm scared that there's gonna be death all around us for a minute, man. You know? Um I have older aunties, my mom, me, um, that's not trying to be on the end of the stick when when this shit hit the fan. We at least try to goddamn it, try to, at least try to be okay or something. I don't know what the fuck to say, y'all. All I know is the shit fucked up around here. You know? It's like when you lose your job or you lose that insurance, cause let me tell you, look, MA, man, look, and straight MA, stay MA, boy, bye. You're on the real. I ain't gonna even lie to you. I ain't gonna even lie to you. I ain't gonna hold you on that. None of that. I'm serious. I ain't gonna hold you on that. Um, I do about this crisis, man. I think that was in like January 2023. I was reading about the Minnesota Hospital Association. It was saying that new Minnesota Hospital Association data shows that almost 2,000 patients eligible for transfer to a continuing care setting are stuck in need in hospital beds. They got shortage of beds, bro. You know, and also, what was that in St. Paul? It reveals a major problem in the statewide care system as well. Hospitals and health systems are struggling to properly discharge patients to appropriate care settings. Like, like for me, for instance, I'm in rehab transitional, so I'll be going somewhere else. Um, but you know, leaving here and going somewhere else, you got to be staff, um, and they struggling to do that. People don't because some people like need help 24/7. Like I say, like me, some people don't need it, some people do, and it's hard to find that. Um, you know, it's hard to find that, man. December 2022, nearly 2,000 patients were eligible for transfer to a continuing care setting such as a nursing home, group home, or a residential mental uh, health treatment facility, but could not be discharged from inpatient care due to their lack of capacity in, in care settings. This resulted into like 14,000 extra hospital patient days. Um, it's a reflection of the recent patient census situation, census census situation in both rural and urban hospitals. And that's the truth, y'all. You know, I'm one of them patients that was eligible to go to a group home, residential, residential living. They don't call them group homes no more. Um, you know, it's like with me, it was like okay, like discharge delays. Harm patient health outcomes. For real and recovery because the places that they was showing me, I was looking at other people that was there and you know paying attention to how their care was or how they was getting taken care of and while they was in their house or they assisted living. Um, I went to a couple of places and a couple of places I didn't agree on due to that. They care. I saw a man. I saw a man in a wheelchair, uh, just like me, uh, a wheelchair, uh, a motorized wheelchair, and I was coming to see the crib. Right, I was coming to see it, and when he came and pulled up, I pulled up in the back to check the back out, y'all. I checked the motherfucker back out. Right, it's hot to the motherfucker. This one Minnesota was like about I ain't gonna lie, like 85, 90 degrees. I'm hot as a motherfucker. I got on some motherfucking shorts and a tank top. You hear me? So I go see the back. Look, y'all, why this motherfucking man is tilt back in his motherfucking chair. Sun beaming like a motherfucker, man. He's sweating so bad it look like water, motherfucking threw water on his ass. They keep on throwing water on him. You know what I'm saying? Like you pour water. Like what's that girl name? Did the wrecking ball shit in the water? That man. That. So I'm looking at this motherfucker like, what the father fuck? Then I look at her like, you don't see this shit? I'm looking at his hands. Nails long than the motherfucker, bro. Like Edward Scissorhand type shit. Look at his feet. Like his feet ain't been clipped in I don't know how long. And the one of the ladies' name was Stella. She telling me, oh, he's been my resident for 7 years. And he like that? The location worker, Katie, go tell me, well, Mr. King, um, you shouldn't look at that because people have care. No, ma'am, mm-mm. Because if I have my own, assisted living program and housing patients who need care, if don't nobody come and care for them, I have the staff to help, what I'm saying, like bathe them, whatever they need, just even if they people don't show up, I wouldn't have him just around my establishment like that, looking like that, because people, first of all, people like me go come and see the shit, and it's it's good for the patient, it's you feel way better. You feel like you don't feel like shit, man. When you get in a situation where you have to depend on people, you don't want to feel like shit. When you start getting strength and start picking things back up, and shit like that, it's a real battle, man. When you in situations like that, you know. Uh, yeah, but like I was saying, discharge delays harm patients' healthcare outcomes and recovery, and negatively impact other patients who require hospital care, leading to longer wait times in emergency departments or other forms of delayed care. And this is still going on right now, right? The fuck now. Ain't shit changed. And it's just Minnesota. So imagine, all around the world, you know. Look what it said, man. It said the financial impact is almost significant because many payers do not reimburse hospitals and health systems for boarding these patients. Each extra patient day costs a hospital about $2,500. You hear me? That's almost $37 million in unreimbursed costs across Minnesota. The hospitals and the health system. Come on now. What the fuck? Did y'all hear what I just said, man? Man, look, hospitals and health systems are already hanging off the cliff, financially. I think it's with a sharp decline of 172% decline for Q1 and Q2 over the same time period of 2021 in year-over-year operating margin, rise in labor and supply costs, compounding a strained financial system with a broken care will result in pressure on hospitals and health systems, which makes everybody who depend on people, it fucks with them too. So if it's, it is severely fried, man. You know, they say they talking about like what was him, Dr. Rual Corrine, CEO and president of the MHA, says, and I quote, "Our collective mission is to care for Minnesotans in the right setting at the right time, no matter the circumstances, is in extreme jeopardy." Now, they are now listen to me. Let me tell you something, doctor. We know this. The thing is, I'm just trying to everybody saying that Minnesota's in a crisis and shit like that. But what are we doing? What we talking about? What are we talking about? You know what I'm saying? What the fuck are we talking about? What the fuck are we talking about, man? What the fuck is we talking about? Huh? Let me tell you something. There is a severe shortage of healthcare professionals across all areas of healthcare, including nursing homes, long-term acute care settings, and hospitals, resulting in a lack of qualified professionals. You hear me? The lack of qualified professionals to care for and discharge patients in a timely manner. Minnesota hospitals and health systems reported a 25% increase in job vacancies last year, 2022. It's 2023, man. We only in goddamn September. We at the end of the year. So imagine, that workforce crisis went up. They're asking, look, MHA is asking for the state to take urgent action to help stabilize care capacity at Minnesota's hospitals and health systems. How you gonna do that? Okay, well look, you gotta provide premium pay to nursing homes, long-term care facilities, and other residential treatment facilities to admit high acuity patients for care and treatment from the hospital, which they do lack that. I'm just living proof of this shit. Everything I'm telling y'all, I'm living proof of it. You got to provide temporary financial support for hospitals and health systems to offset the high cost of patients boarding in hospital beds and emergency rooms. Increasing medical assistance, MA, we're just talking about MA reimbursements. So increase medical assistance, increase MA reimbursements to hospitals and health systems to better cover the cost of services provided by Minnesota's low income and underserved populations. Because that means they trust MA. MA is a bunch of why just tell y'all. The other thing they have to do is, what I'm saying, they gotta start supporting significant resourcing of the healthcare workforce through, both existing and new strategies, basically, man. for retention, recruitment, and development. That's what they need. You know, but let me tell you something, man. The MHA, man, the MHA, and if for who don't know what that is, that's the Minnesota Hospital Association. It represents Minnesota hospitals and health systems, which employ more than 127,000 people, provide high quality care for patients, and meet the needs of communities. They said since 1917, MHA has worked to provide Minnesotans, hospitals, and health systems with the resource, best practices, and guidance to provide an exceptional patient experience and high quality, affordable care that extends beyond the hospital walls. Um, at one point, yeah, it was like that. At one point, they try to make when they try to send you shit or tell you some goofy ass shit like that. That's how it used to be. Yeah, that's how it used to be. You know what I'm saying? Like for real, this week is it like the discharge is like the discharge gridlock because don't nobody just want to go anywhere. Don't nobody want to go just anywhere, bro. You know. So now they have this 2023 Health and Human Services package. Um, I think they say I think the Minnesota Democrats. You heard what I said? Minnesota Democrats passed the uh Behemoth Health and Human Services budget on the last day of the legislation session. It was arguing that the nearly 1.1 billion in new general fund spending over the next 2 years will give more Minnesotans access to the health care and social services they need. I think they need more than that. 1.1 billion ain't enough. It ain't enough. I don't think it's enough. Okay, now they say the bill is truly born of a commitment to our shared humanity. Sarah Representative Tina Lineblin, DFL Rochester, on the House floor. And I quote the bill, which according to the Senate spends 6.2 billion from the state's general fund in the next 2 years, passed both chambers on party line votes. So now you can the undocumented Minnesotans can enroll in Minnesota Care. That's what they saying. So I guess over what they telling me, what I got right here, what I'm telling y'all, what they telling me is over 40,000 Minnesotans are eligible to enroll in the state's public publicity subsidized insurance program for low income residents known as Minnesota Care, right? It said Minnesota is now the second state to allow all low income residents to enroll in public insurance, regardless of uh, immigration status. The state aims to begin enrolling undocumented residents in 2025. About 17% of Minnesotans uninsured are undocumented, and the expansion is estimated to cost Minnesota about 8 million in the first 2 years and will jump to 100 million in the following 2 years as enrollment increases. So that means they gonna run out of money. You hear me? That's what that means. They got the money now. They're gonna run out of money. That's all. They're gonna run out of money. It says workers without status have made enormous sacrifices to our state, paying the highest toll to keep our state running during COVID-19. All people deserve access to health insurance. That's damn right. We do. Because people, it's different insurance, man. Like right now, I'm going through that right now. I'm going through that shit right now. My location worker, I had UCare MA. I was kind of comfortable with that because I get my teeth fixed, cleaned, routine checkups, all that stuff. And me in the process of doing me in the processes of the situation that I'm in, uh, my insurance had was changed, and now that it's changed, right now a lot of things I can't do. I gotta set up other rads um, through MA disability MA. Um, she basically didn't tell me how that goes, but that's nor here nor there. Um, but back on track though. They said lawmakers originally proposed expanding Minnesota care eligibility to residents above the income cap to buy into the program, but legislators ultimately delayed the expansion by at least 1 year to study its impact. The state must conduct an actual analysis to determine state costs, premiums, and projected enrollment among their details. So, like this just told you, ain't no expansion, ain't none of that. We go do this. We'll do this little whoop, see how it turn out, and we gonna go from there. That's what they saying, Jack. Minnesota could be the first state to offer a government-run public option healthcare, but the earliest Minnesotans might be able to enroll is in 20,000. I mean, 20,000, 2027. So, um, that's just one thing. The crisis, y'all. The crisis. Like I told y'all, I will have different type of other categories, but I do want to touch on um this abortion restrictions that shit, right? So the abortion restrictions got repealed, right? And I'm just, bro, look, the bill repealed most of the state's restrictions on abortion, many of which were already ruled unconstitutional by the district court judge. Those included requirements that women wait 24 hours before having an abortion, that abortions after the first trimester be performed in a hospital, and that doctors recite a list of medically claims about the risk of abortion. Lawmakers also repealed the state's restrictions on abortions after, which existed in a legal gray area because of the 1970s ruling that found it was more restrictive than the since overturned Roe versus Wade decision allowed. Um, I'm just gonna keep it real, man. Who is you? Who is you to tell a woman what to do with her body, man? What? What? Who the fuck? Wait 24 hours before having an abortion. Motherfuckers, you crazy? What if this woman, God forbid, what if the woman get raped, man? Hmm? You ain't think of that, huh? Yeah. You ain't think of that, huh? Y'all did, but y'all don't give a fuck. Y'all about the money. Y'all about the money. I just I just don't understand that. Who the fuck is y'all to tell any motherfucking female what to do, man? Y'all going too far with this shit. Y'all going a little bit too far, you stupid motherfuckers. I'm tired of it. I'm sick of it. I'm through. You know, I'm really through. I'm through like a motherfucker. But I'm gonna go and tell you about the lawmakers. Okay, so it says the lawmakers also left in place a version of the Born Alive Act, but changed the mandate the doctors preserve the life. of babies to care for babies consistent with good medical practice. Pro, Proponents say that change is compensated to parents who have to induce pregnancy early because of severe complications. Those parents will be able to spend time with their babies for whom no medical intervention will save their life. Are you hearing this shit, G? The requirement that both parents be notified and a minor seek an abortion was also left in place, even though the law is not in effect because it was ruled unconstitutional by a Ramsey County judge last year. Lawmakers also eliminated the Positive Alternatives Program, which funded so-called crisis pregnancy centers that encourage women to carry pregnancies to term and provide resources to them. Under Minnesota law, grant recipients under the program were explicitly prohibited from counseling clients and abortions or referring them to organizations that provided abortions. Are you fucking serious? Do y'all hear this shit, man? Do y'all hear this shit? Echo, mute TV.
Okay.
She always listens to shit. But yeah, man, this shit is crazy, man. I don't edit shit. I'm from the hood. This is my podcast, man. I ain't editing the motherfucking thing. So, I got the little whoops in the background like I told y'all. I already told you, motherfuckers. I already told y'all that I'm disabled too. But I won't let that move me. I won't let that, um, I won't let that make me. I won't let that stop me from trying to reach goals. I'm not gonna let that watered down shit, get the best of me. It hurts though. I'm gonna have another episode about that, but this was just about a few things about healthcare, man, and the Health and Human Services Bill. I wanted to tell y'all about. Don't forget about that because that shit's still in play. They still trying to push that shit for the women. They still trying to push it. So women, I just want y'all to be careful out there. If you don't have no motherfucker, felonies and all that goof ass shit, yo, go get you your license to carry. Take some classes when you get that pistol. Get real surgical with that motherfucker. Do you hear me? I'm talking about surgical with that bitch. You ain't hear what Denzel said. I'm surgical with this bitch, Jake. That's what I mean. Be surgical with that motherfucker. Because there's some crazy motherfuckers out here that's trying to take the pussy. You trying to take the pussy, man. First of all, it's too much pussy out here. Listen, they throwing the shit. They throwing that shit. They throwing it. Bitches out here fucking for bitches out here fucking for weed and cigarettes and shit. Man, listen, I heard some fucked up stories around here, especially Minneapolis, St. Paul too. Whoo! I'm trying to tell ya, but yeah, like I said, I'm gonna let that goddamn make me, and that's what that is. But yeah, like I said, this was about this little short word about the health situations, and I want y'all to hear my episode and you know just vibe with me, y'all. You know what I'm talking about? Just vibe with the nigga, vibe with me. But this was about health. Definitely was about health. You didn't need. Um, There's gonna be more topics about this health shit because of my situation, and I will be talking about my situation uh, in one of these episodes when I get the courage and the heart to do so. Just not right now. It will be on here though. I already told you I was in a wheelchair, so I know y'all like, what the fuck? How you get in a wheelchair? But it's gonna come. I got a video coming out too. Um, that's actually talking about my situation that happened. Um, yeah, Thank you guys for listening to King's Firmament. This is Terrell King, aka Terrell, the guy. You hear me? Oh my soul, foo. Hey, but y'all, I really appreciate y'all vibing with me. I'm out.